Good morning, all. My name is Lakasha Hines. I'm a CNA mainline nursing in rehab. I live here in Philly. I'm married with 4 kids. My husband and I have a son and 3 stepdaughters. I'm here today to speak about my family needs health care reform. I've been a CNA for 14 years, and I like my job. I love the residents that I take care of every day. I've been in my job for 10 years, but recently my health insurance cost is going crazy, and Congress has to do something about it now. My husband and I are both healthcare workers, but we don't have decent health insurance for our family. Our children are covered by Sipp, and my husband got off of his job insurance because mine was cheaper at the time. But then we got Aetna and it doubled. Now I'm paying over $200 a month for health insurance just for me. I used to pay $45 a pay, but now it's almost up $98 a pay. When I think of things I could be spending the money on, it's really sad. My husband has high blood pressure, and him being uninsured is stressing me out. Paying for doctor visits and medicines out of pocket is setting my family back. We don't have that kind of money where we can just pay up front all the time. I'm also worried because I see how healthcare insurance companies try to use loopholes to deny people because of pre-existing issues. They don't treat us like customers. They have all these rules, and if you don't follow them, they use it against you. I don't understand why Congress hasn't fixed it yet. It isn't fair that they have the best insurance in the world, and I can't get it.
That's right.
Why can't I live without the worry about how I'm going to get health care? I'm here to say Congress needs to fix health care today, not tomorrow, definitely not next month. People like me can't wait one more minute for real health care reform. Thank you.
Yes.
When do we want it? Now! What do we want?
Healthcare!
When do we want it?
Now!
Thank you. Thank you. State Representative Babette Joseph is here with us. She's been fighting for healthcare reform. You want to say a word?
What do we want?
Healthcare!
When do we need it?
Now!
My name is Kati Sipp, and I'm the political director of SEIU Healthcare Pennsylvania, which is the state's largest union of healthcare workers. And Lakasha is one of our members. We represent thousands of workers across the state of Pennsylvania who work in nursing homes and hospitals, and every day they see the crisis of healthcare reform that our country is going through. Obviously, Lakasha sees it from the perspective of not just of a provider of healthcare, but also of somebody who's a consumer of healthcare. And she knows that this is a problem we have to solve today. But I want to take a step back for a minute and have a conversation, not just about what it's like to be a healthcare worker in need of healthcare, but also about what it's like to make change in this country. How many of you all in this crowd are parents or step-parents of children, whether they're grown children, little kids, whatever they are? Raise your hand if you're a parent. Great-grandchildren. God bless you. I'm a parent of 2 children as well as a political organizer. My son Isaac is 6, my daughter Alina is 10, and I think that all of us who are parents have had the experience sometimes of feeling like parenthood is a constant struggle of picking your battles, right? You have to decide every single day, is today the day that I'm going to get pick a battle with my kid about how they're hitting their sister, how they're not doing their homework, how they're getting up in the morning and not getting ready for school on time. Every day we got to make these choices and pick these battles. Sometimes for people with kids older than mine, it's do I got to have a fight with my kids about whether or not they're out running the streets. We have to make these choices, and we have to make sure that every day we're picking our battles. And how do we make those choices? How do we decide whether or not this is the battle that I want to be in today? We decide what's it going to cost me if I lose and what's at stake if I win. And today, I think that we have to look at this equation about healthcare reform in this country, and we have to make some decisions about what is it going to cost us if we lose. What is it going to cost? It's going to cost the next Billy Kohler, one of our members whose brother died earlier this year from not being able to afford to change the battery in his pacemaker, which cost $10,000. The next Billy Kohler is going to keep dying if we don't have healthcare reform in this country. Lakasha's husband is going to keep being discriminated against when he tries to get healthcare because he has a pre-existing condition. Tens of thousands of healthcare workers in this country are going to go to work every day and have inadequate health insurance because we don't have health insurance reform in this country. We can write a book about all of the things that are wrong with our health insurance system. And I think that what we have to look at is not just what do we have that is going to cause us all these problems, but what can we win if we get health insurance, even if it's not the ultimate change that we want. What is at stake for us? What can we win? Here's the things that I think that we can still win. We can still win an end to discrimination against pre-existing conditions. We can still win greater affordability for health insurance for the working poor to cover the 40 million people in this country who don't have health insurance. We can still win an end to lifetime caps in health insurance so that people are not going bankrupt because they get sick. So we have this choice to make to you, and I'd say to you, my brothers and sisters, that this choice is pretty clear to me, and we have to make it clear to our members of Congress, and we have to start treating them like we would treat our kids if they were acting like spoiled brats, which is frankly what Congress is acting like right now. They are people who have health insurance of their own. They don't have to wake up every morning and worry, is this the day that my boss will decide to stop paying for health care?
That's right.
They don't have to worry that they are going to lose their house because they get cancer and they have to pay a huge amount of money out of pocket to cover the cost of that care. So we need to do things to hold our Congress people accountable and make sure that they understand that there are clear consequences for not dealing with the health care reform crisis. So what does that mean? Now, I know that, John started to take off his belt when I started talking about treating members of Congress like bratty kids, and that's not exactly what I'm talking about. But I think that we need our members of Congress to understand clearly that we will be in front of their offices. We will be on the editorial page. We will be having rallies like this on Saturday mornings when some of us were at work until 2 o'clock last night, like the 32 BJ members who are here today. And we are not going away. We are going to be on TV, we are going to be on the editorial pages, and we are going to be in the streets until we win affordable health care coverage for every man, woman, and child in the United States of America. Thank you very much for coming here today. I appreciate it. I'm sorry that we don't have a bullhorn. I hope you can all hear it.
We heard you, loud and clear.
Thank you.
Thank you.
It doesn't take a bullhorn to let Congress know what we need. It doesn't take a bullhorn to let Congress know what we need. We're all here on a cold day, on a Saturday morning, at a time when we could be doing other things. This is what's going to send them the message. They need to get their act together, they need to figure out the way to pass the bill, and they need to do it right now. What do you want?
Health care!
Do you want it?
Now!
Stand with us and fight! Health care is a right! Stand with us and fight!
Health care is a right! Stand with us and fight! Health care is a right! Stand with us and fight! Health care is a right! Stand with us and fight! Health care is a right!
All right. We may need to teach members of Congress like children, as Katie says, but I actually don't want to keep congressmen without waiting at the art museum steps. So we're going to start marching there and start chanting as we march. Those of you who can't march all the way, if you can drive to get there, if you can't come, that's okay too. We've made our point here. We're going to make our point up at the art museum steps. Let's get going. Healthcare is a right. There we go. Go down to the panel.
Thank you.
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now! Healthcare! Now! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right! Stand with us and fight! Healthcare is a right!